During debate on this week's health care reconciliation bill, I argued for passage of my amendment to apply the health care reforms signed into law on Tuesday to leadership and committee staff in the Congress and to the President, the Vice President, the President's Cabinet, and White House staff. All of these people remain untouched by the reforms that have taken effect for the rest of the country. Now, after I offered my amendment, the White House quickly announced that President Obama will participate in the health insurance exchange that starts in 2014, effectively endorsing my amendment to make sure that political leaders live under the laws that they pass for everyone else in this country. The principle shouldn't be voluntary for political leaders, though. My amendment, it didn't pass, so while President Obama will be a part of the exchange if he's reelected, the Vice President and other top administration officials in the executive branch and the Congressional staff who were responsible for helping write the overhaul will not live under the Obama health care reforms. Now that sends a message to the people at the grassroots that the health care reform is good enough for you, but not for us. The amendment followed my efforts last fall to make sure that there wasn't a double standard and that public officials who pass the laws and work so hard to get laws changed experience those very laws themselves. Thanks to an amendment that I got included during the consideration of the bill in the Finance Committee, the new health care law already required members of Congress and their personal office staff to get their health insurance through the new exchange like you would have to. The principle is one that I fought for going back now, well, about 2 decades, when I first offered legislation to apply civil rights, labor and employment laws to Congress for the first time. In fact, there were 12 laws passed by Congress during that period of time of the 1930s to the 1990s where Congress exempted itself, and that was wrong. So before President Clinton signed into law my Congressional Accountability Act of 1995, Congress had routinely then, as I just explained, exempted itself from these laws. The bottom line is, if this health care reform is as good as promised, the members of Congress and the staff and the President and his staff who wrote the bill should know it firsthand. In other words, experience this new law. If there are problems, they'll be able to really understand them as should be.